Hello everyone. Today we will discuss about cyst in surgery. Cyst is a very common surgical condition you will often encounter in the clinical settings, as well as it is a short note question and it can also be kept as a spotters. And a cyst is a pathological cavity occurring in the body containing fluid, semi-solid or gaseous material. Cavity is lined by epithelium. The epithelium lining may be true epithelium or endothelium. The contents are not formed by pus, hence different from abscess. A cyst usually have a well-defined wall. If a cystic cavity lacks epithelial lining, it is called a pseudocyst. So classification can be done based on congenital cyst, acquired cyst, traumatic cyst, neoplastic cyst, parasitic cyst, and pseudocyst. As we have seen earlier, pseudocyst will not have any epithelial lining. Example, pancreatic pseudocyst or a ganglion. Parasitic cyst will have parasitic infestation. Example is hydatid cyst. Neoplastic cyst will be present in tumors. Example, ovarian cystic tumors or cystic lymphangioma. Any cyst that occurs after implantation or after injury is called as traumatic cyst. Example, implantation dermoid post-traumatic epithelial inclusion cyst. Acquired cyst will be usually in obstruction or degeneration. Examples include sebaceous cyst, retention cyst, or ganglia. Congenital cyst usually it comes along the line of development defects like dermoid cyst, epidermoid cyst, thyroglossal cyst, bronchial cyst, or cystic hygroma. Usually it will be slow growing swelling, painless, round or oval in shape with a smooth surface and well defined margins, and skin over the swelling are normal. But if there is any complication, there will be pain and tenderness associated with it, redness and warmth in the inflamed cyst, sudden increase in size due to hemorrhage or rupture, discharge in rupture. Coming to the clinical examination, during inspection, you have to make a note about site, size, shape, smooth surface, whether the skin is normal or punctum. If there is punctum, it is usually in epidermal cyst. Palpation, it will be usually normal. Only in case of infection, it will be raised. There will not be any tenderness. Consistent will be cystic or doughy. Well-defined margins will be there. Fluctuation test will be usually positive, and transillumination is positive in clear fluid cyst. Mobility is freely mobile over deeper planes. Relation to the skin, it is not attached except in case of epidermal cyst, and it is usually have no influence on the muscle contraction. Coming to the investigation, ultrasound is the first line investigation. It differentiates cystic from solid lesions. FNAC confirms cystic nature and contents. MRI is deep-seated or complex cyst in head and neck and CNS. In CT scan, is indicated for intra-abdominal or retroperitoneal cyst. Blood test will usually show raised inflammatory markers if infected. Lipoma, abscess, neofibroma, enlarged lymph node, hematoma, and vascular swelling are the differential diagnosis. In case of lipoma, it will be soft, lobulated, slip sign positive, and non-fluctuant. Abscess will be painful, tender, local warmth, systemic fever will be there. Neurofibroma will be firm, buttonhole sign positive. Enlarged lymph node is also be firm and may be fixed. Hematoma will have a history of trauma and color changes. Vascular swelling will be pulsatile, compressible, and bruit will be present. So to summarize, cyst commonly present as painless, low-growing swellings. Proper clinical examination supported by ultrasound and FNAC is usually sufficient to establish the diagnosis. Differentiating cyst from other soft tissue swellings is essential for appropriate management and surgical planning. I hope you have learned from this presentation. Thank you for watching.